I care for people at like a nursing and a medical level, but I care for not only their physical health, but I care for emotional, physical, and spiritual health, for however that works.
She got a tight grip on life. She knows what she wants. Everything she holds in her hand, she holds a tight grip, or a secure foundation. She knows what she wants in life, and she's gonna go for it.
It's a resilient person, regardless of whoever you see that person as. Like, I think everyone has had that fight to continue.
I see someone moving forward. They've been through something, you know what I'm saying? I see somebody going somewhere when you look at that.
Even with like the struggles that everyone is facing, regardless if it's work or at home, because of what's happened with COVID, it is what what it is, but we still are trying to move on. We don't know what exactly we're walking into every single night. I've been at Denver Health for 5 years as an employee. Right now, I'm an acute care float pool nurse. At the very beginning, I was very vocal about having staff just try to be as like best as they could, in terms of being like, you know, just last week I was able to hug you and now I can't. And that was really hard for all of us. But in terms of like what we would interact with our patients and their family members, we would have like a lot of people calling in being like, is my family member going to die? Like the first patient that I ever sent to the MICU, they told me, is this the Rona and am I going to die? But with COVID at the very beginning, it was really terrifying, because you would wonder, like, am I going to see this person? I might be a nurse, but I'm someone who is very passionate about the social issues that happen. I just feel like I am someone who might not necessarily be an activist, but someone who cares about, you know, the state of this country moving forward, to have an equitable approach for everyone moving forward. Thomas had said, so how do you usually like use your stethoscope? Oh, it's, you know, like around my neck if I'm not using it, or I'm like having it in my ears and like listening to people. And he was just like, well, we're gonna try to do a powerful pose. As nurses, you guys are the heart of, like you're the heart of the hospital, and you're the ones that get stuff done. It's the providers that will order things, but you're the people that essentially are trying to carry out those interventions to improve patient conditions and outcomes, right? It's very surreal, because I feel like there are so many amazing people that he could have showcased, but he chose me. His work is phenomenal, and like that's not even like the right word to describe it. Like there's nothing that describes how amazing his art is. Like even when I saw it, I was just still shocked, because I'm like, it looks exactly like me.
You know, you see vision. Yeah, it's inspiration when you look at that picture.
I feel like to have someone like me, like maybe there's something about them that they could relate to. Like maybe they don't know who I am. Like as a nurse, as like a first generation, you know, like student that became like where I am, it's something that a lot of people can relate to.
She's a nurse, she's doing something, she's aiming high, she's aiming even higher. And you can see the look in her eyes, she ain't done yet.
Like I think everyone has had their different types of experiences of how the pandemic has really shaped them. Especially like with George Floyd, like that was a huge statement of what had happened last year, and that how it had changed a variety of things within this country. I remember asking Thomas, like, I don't want to take up that space, because like he is such a huge and prominent figure towards like what has happened within the last year. But he was saying like he really wants to just rotate the art and just understand that like what has happened within the last year has helped progress different changes within years. So he'll be rotating it without fail. Our work is never done. We have 12-hour shifts, but it's a 24-hour process for sure. And the only thing that we can do is just try to, you know, stop the spread, whether it is, you know, getting vaccinated, getting masks that help you stay distant from people, whether it's, you know, distancing from other people, or whatever you need to do, you know. It's just whatever we can do to try to get back to a normal place of where we were. We'll never get back to normal, because normal is really relative, but just trying to make sure that we can somehow have that that happiness that we had previously that we seem to have forgotten over the last 18 months.